So just recently, in this summer, the Supreme Court finally made their decision on the act in June. 1 second. And it was a 5-4 decision with Justice Roberts being the deciding vote. And for the most part, the law was upheld. The individual mandate was upheld in the law as a tax, not as under the Commerce Clause as was originally argued, but that's somewhat immaterial that it was upheld. And the Medicaid expansion was the only thing that was really changed about the law. And the only thing that they said, that Justice Roberts in his opinion said, was that HHS can no longer use their typical enforcement power that they've had since the beginning of Medicaid to compel states who choose to participate in Medicaid to do it in the way that they set out the rules, which has been removing funds from the state. Now, this is actually a power that the agency has never used fully, but that essentially, without that enforcement mechanism, made this Medicaid expansion optional. So I want to spend a little time talking about the Medicaid expansion explicitly because I think it has a big impact specifically in Texas, but really around the law overall, because it leaves in states that choose not to do it, it leaves a large hole in the ability to counter some of the costs and to get people covered like we need to. So with Medicaid expansion, the idea is that in 2014, all Americans that are at 133% of federal poverty, and there's actually a 5% income disregard, so in some places you'll see that 138%, that they are eligible for Medicaid, regardless of whether or not they have children, regardless of their individual disability or ability or age. So currently in Texas, it's primarily children, overwhelmingly children who are covered by Medicaid, or the disabled and the elderly. So this means, and I don't want to step on Dr. Buckley's area for Texas, but here in Texas, that looks at about 1.2 million Texans who could be eligible for coverage who aren't otherwise. And just so you know, that gives you about $26,000 a year for a family of 3. That's what 138% of federal poverty looks like in 2012 dollars. For the states, the federal government pays 100% of covering that new population for the first 3 years of the expansion. And then it gets sort of winnowed down that the state pays a little more, the federal government pays a little less, until in 2020, it's a 90-10 match. So a handful of governors have already said, no, we're not going to do this. Texas, Florida, I think Maine, there's who have already come out and said that. It's not clear that that's the bottom line, and HHS has actually said there's no deadline for saying when or whether or not you're going to do that. They want to leave the door open as long as possible. Because even with regular Medicaid, now all 50 states have Medicaid for the bottom line population, and the last one to adopt it was Arizona in 1985, which was about 20 years after the original law being passed. So if Texas doesn't do it now, that doesn't mean they can't do it in the future. And to see, this is a map, and I don't know if the colors show it very well, but basically what this map is showing is of adults who would qualify for Medicaid under the new expansion, how many are currently uninsured. So these dark orange areas are looking at 45 to 56% of the population that's below 138% of federal poverty would be eligible for Medicaid. Of course, we see Texas, Oklahoma, Florida, many of these states where governors have already come out and said they aren't interested in doing it. So I know I've got very limited time here, so I just want to wrap up very quickly. And one of the changes to insurance that are happening now that are trying to make some of the cost containment and other things, some of the really popular stuff, no pre-existing condition exclusions. For children, it's already been enacted. Everyone, it will be available after 2014. We're talking about things for kids like premature birth, diabetes, asthma, things like that. pre-existing condition is sort of a factor of age. And when you age, things happen. And so as we all get older, there's more of an issue with that. And then, of course, preventive care without copays, cost controls on insurance, this 80/20 rule, and then, of course, rate review, which keeps unjustified increases in check. So there's still a lot of work left to do, and we could have a 4-day conference on what's left to do. But one of the things I want to emphasize is helping people understand the law, and moving towards enrollment is one of the biggest things. And the upcoming election will have an impact on where we move forward with this. So I don't want to step on anyone else's time, and I pass it over to Dr. Begley to talk about Texas with our